Okay, so good afternoon, everyone. My name is Sha'ib Jama, aka Jet, and I'm the Community Health and Wellness Coordinator at ETSS. Welcome to today's training on addressing emergency response, disaster preparedness, and culturally tailored behavioral health response services for the Afghan community. Thank you so much for being here, everyone. This training is the second training in the series, and we have 4 more trainings left after this. So welcome to the Behavioral Health Disaster and Planning and Response for the Afghan Community. Next slide. So this training is in reference to a presentation, a research project that we did last year in 2024. The report is titled Culturally and Linguistically Appropriate Emergency Preparedness and Crisis Response for Ohio's Resettled Communities. The authors are Dr. Saruna Gamiri, which you will be hearing from today, Denise Martin, Dr. Adhikari, Dr. Saleshi, and myself. And we will also be hearing from Isha, which did the qualitative portion for this grant today. So before we get started, I wanted to go over some group agreements. So first, AI note takers are not allowed in state meetings or trainings. This session is being recorded and will be made publicly available. And you are welcome to use the chat and Q&A features to ask questions and communicate with the presenters. If you are an Afghan community member that is joining virtually, we have Zarwa, which is moderating online virtually, and she will be responding to all questions, even from behavioral health responders and emergency responders and behavioral health professionals. So feel free to ask away, and if we can't get to your question during this presentation, there's an email that you can send your question to, and we'll address it when we can. So now I just want to give some acknowledgements. So first, ETS has obtained this grant through Ohio Moss. So I want to thank Ohio Moss. Specifically, I want to thank Liz Poprocki, which is the Behavioral Health Treatment Coordinator, and Dr. Adhikari, which is the Administrator of Disparity Research Lead for QPR. I also want to acknowledge Suzanne Schaefer, which at the time was the Director of Adult Services, and Amy Harkar, which is currently the Director of Community Health and Safety at ETSS. I want to thank them for their dedication and their project leadership. I also want to thank the entire ETSS Community Health and Wellness team. As you will see today, we put in a lot of work into this, and it was not a one-person show. It was a lot of people supporting each other and helping each other. And then I also want to thank Israel Hora. She was an intern a little bit at that time, but she represented the Ethiopian community. So more acknowledgements. These are the community-based organizations that we worked with, and I just wanted to thank them all. Today, we will be hearing from the Afghan community, and we'll be hearing from Immigrants Integration Station. And if you have any questions for that community-based organization, you can reach them at that contact info. So these are the questions that the community leaders will be answering for each of these presentations. So the first one is, can you share what was happening in your country that made people feel unsafe or want to leave? How long has your community been in Ohio? What about your culture and its customs do you want people to know? How has your community given back to Ohio communities? Have you experienced a disaster or emergency while living in the United States? If so, what were some challenges you experienced in accessing help and what was successful? And last question is, how can behavioral health providers and emergency response professionals better serve you and your community? So I will pass it on to Mr. Ali from the Immigrant Integration Station to go over the presentation.
Good afternoon, everyone, and welcome everyone as well. And my name is Irfan Ali Shahunzada, and I'm the CEO of the Immigrants Integration Station, a nonprofit organization that's running in the west side of the Columbus. So today I want to just present this presentation and the couple of the things that I want to mention that probably we just made this presentation. So let me start because or judges just give us a short time. Um, okay. So what happened in 2021 when the Taliban and the new government that now it's running, they took over and they took the power and by not by the voting, but it's they got the power over there in Afghanistan in 2021 and the month of August. So it was so quick and so short. And why we just felt why we left from Afghanistan, it was not just because that we are for for anything that we have to be for the for education or for the Democrat or democracy or no. It's especially was because the Taliban banned the schools for the ladies from the for the girls and just they banned the work for women and the hospitals and the offices and so many things over there. They took the jobs from women and make a very short space for men who just work with the U.S. Army, U.S. Special Forces, or U.S. Alliance back in Afghanistan. So indirectly, they were just so therefore who work and help the and this last 20 years with the U.S. government, so they just was not feeling safe. So just we moved from Afghanistan to survive. Um, so including my family as well. We came in 2022 in Columbus, but we start our journey to moving from Afghanistan to United States, especially to Columbus. It took 6 months. So we have a question that how long we have been here. Many of the Afghan families just they arrive after the collapse of government back in Afghanistan in 2022 and 2020. It started in 2021, but after the 2022, the thousand of the Afghan family, almost the first report said that it was 97,000 individual or 97,000 families that they fell from the Afghanistan, and it took 6 months to arrive to any of the states in United States, especially when they start their journey. They stayed 7 days or 10 days or 5 days, or people are still in Qatar, Dubai, Spain, Germany. So most people are still over there because they are uh, trying to get clear and trying to do some of the process that they remain. But my situation, I stayed 7 days in Qatar for some of the clearance, and then they took us to the Germany. There was a camp by the Ramstein, and then we moved to 49 days. We stayed there. We did some medical clearance. We did some other border police. They did some clearance. After that clearance, they took us to the as the with some other families to military camp, and where the IRC and other the organization are clearing or working on the finding out if anyone has any criminal or anything that's pending or just remaining or any cases on them. So everything was clear over there, and then at the beginning of February 2022, we moved to Columbus, Ohio. And I was the first guy that started my job with a community refugee immigration services with a Chris as a case worker, and still I'm just working with communities. Let's talk about little bit about culture. In our culture, our Avant community are very polite, and they are very hospital. Everyone is just trying to show their hospitality. They are very doing a warm welcoming. We have a family central system, so the older of the house, everyone should respect, and everyone should ask and do that. We have a couple of the poetry, and according to our poetry, we have a couple of our poetry that the most one that they can very motivated Nazo Ana, Malalai. Malalai, who was the best of our country, and as well the others. So we, because of shortage of the time, so let's move on. So we came to the US to rebuild in safety and committed to being a good neighbors. This is the something that we have to go have it. And over past 3 years, the Afghan community in Ohio have been be actively giving back in meaningful and impactful ways. Despite like facing the trauma of displacing, our community has stepped up and served support and the strengthening of the border Ohio society. So we did a volunteer support, woman lead program, especially we are running a woman for woman, so we have some volunteers that they're doing for woman for woman, a driving class, ESL class support, and collection, donation, distribution to houses and everything. We are very supportive and very bound community. We have a food drive as well. Uh, we have a question that any disaster. Yes, we faced a disaster during the one time that there was a shortage of electricity or something like that happened because of the weather. But we support our community and we help. So this was we sorted out. And the challenges, now I want to take a minute for our challenges. We have our challenges now because when our community people come here, we're short of languages because we need to learn the language. And this is a big one, and they don't know how. We need a more and more like culture orientation, because there is a big issue of they don't know how to uh, do something in a community and other stuff. Education problem, how, for example, if someone have a bachelor degree or master degree, they don't know how to accredit this one. Language barrier, we don't like, we have a biggest one. Awareness how to report issues like flooding and utility outage, barrier to calling 911, including uncertainty and language barriers over there as well. Lack of transportation to each warm shelter and food pantries as well. uh, Successes, let's share. Nonprofits like ETSS, US Together, and the Immigrants Integration Station mobilize quickly, deliver space, heaters, warm clothing, and emergency food. Churches like Bethel International, United Methodist Church, Masjid like Noor Islamic Culture Masjid, and our Afghan volunteers did free interpretation, free transportation to our community, and especially in Dari and Pashto, and helped many family responded safely and took the families during that issue to their home. So they over time, families become more familiar with how to prepare for the storm, and even join these community emergency response teams training. These experiences have helped our community grow stronger, more aware, and better connected to the local resources for the future emergency. How we can be like the emergency responses and better serve in your community according to the mental health and these things, and what improvement can be made. Hire a trained culture aware staff, offer trauma informed faith respectful care, use community based outreach, and what improvement can made. Provide mental health education and comfortable space. Make emergency system simple and multilingual. Involve religious leader and elders, and connect these Avant families to the resources. So all these things are getting done, and it's running by the ETSS, Chris, us together, and Jewish Family Services. So immigrants integration station, my one, and so that's everything we do, and we are looking forward for the more contribution and more support. If you guys have any question, please, you can ask me.
Okay, so thank you so much for that, Mr. Ali. Now I'll just be quickly going over a few gaps from the Afghan community that Mr. Ali hadn't already presented and shared with us. So just some gaps that the community member didn't get to expand on because of the timing is first, Afghan women face additional barriers. So due to cultural norms, limited English proficiency, and lack of driving skills, and also reduced social connectiveness. And then few Afghan voices are in local disaster planning and response efforts. So that is just some gaps that weren't covered extensively that I just wanted to point out. So now I will go over some service, just the importance of these webinars. Let me make sure. Oh, do we have a question in the chat? Okay, so we do have a question in the chat. Um, if it's related to the Afghan, it is. Let's just answer it now briefly before we move on. Do you want to come back here real quickly and just answer the question? Okay, so Mr. Ali, the question for you is how do you understand and how do you basically handle the two different cultures, Pashtun and Hazara? Did I say that right? So,
Yeah, so the Pashtun is a majority in Afghanistan because it's a big one, and Hazara. So they speak the like Dari, but with a very small difference, and easily they can be, understand. I just asked couple of our Hazara community members over there, but due to something happened emergency, so couldn't come. They have the same culture, a little bit like not a big difference. So we have the same cultures over there. We cook the same. They just the Hazara families. We have a like it's a not two religion, but in one religion it's a small difference, like Shia and Sunni. So the most Hazara families are Shia and the Pashtuns are Sunni. So, but this is a difference. There is another big differences between the Hazara community and our Pashtun community.
thank you so much for that. Is there any more questions before we move on to the rest of the presentations? And I hope for the person that answered that question, your question was answered. Okay, so thank you so much for that, Mr. Ali. That was very informative. I didn't even know there was a distinction, Pashtun and Hazara. And so thank you so much for that person that asked that question in the chat. So now I'll just go over the importance of these webinar series. So service providers often lack guidance or on culturally appropriate approaches to preparedness, response, and recovery. So this is what this training is basically wants to do is give you the tools so that you can better serve these communities that we're going to go over. Cultural misunderstandings can weaken service delivery. So if you don't understand somebody's culture extensively, you might not be able to basically serve them the way they deserve to be served. And then the webinar will disseminate the findings from our previous study, which was very important. We learned a lot from these communities and we want to share it with everybody. And then we also want to build cultural competence to basically bridge the gap. And hopefully this allows more of the Afghan community to be involved in emergency preparedness. And maybe this allows for you to get contacts from this community as well. So now, please save the dates for the next 4 webinars. So July 1st is the one we're in today. And then the next one is July 8th for the Bhutanese community. July 17th is for the Somali community. July 24th is for the Ethiopian Eritrean community. And then August 8th is for the Congolese community. Okay, so now I will be passing it on to Dr. Saruna to go over the quantitative results. Take it away, Dr. Saruna.
Good afternoon, everybody, and thank you so much, Jet, and Mr. Ali for that wonderful presentation. Good afternoon, everyone. My name is Saruna Ghimire, and I am Associate Professor at Miami University in Ohio. I was also one of the team member, as Jet introduced earlier, for the 2024 study that we conducted last year. And today I will be sharing with you the findings from our quantitative survey. So just a brief overview of what we did before I jump into sharing the findings with you. So we did a survey with 266 adults 18 and over from 5 different communities and living in central Ohio. We have participants from Afghan, Bhutanese, Congolese, Ethiopian Eritrean, and Somali. But today we are focusing on Afghan community. Of the 266, we had 49 participants from the Afghan community. Participants were recruited by ETSS with the help of a community-based organization. For Afghan community, we collaborated with Immigrants Integration Station, and Mr. Ali represents the organization, and we did hear wonderful things he had to say and share with us. So our survey was available in Qualtrics and also on paper. For Afghan participant, most of them preferred to complete the survey in paper. And Mr. Ali and IIS helped us to distribute and disseminate those paper-based survey. To ensure accessibility, we had survey in multiple languages. Uh, Dari and Pashto were the two languages for Afghan community, and these other languages that you see on the screen, Amharic, Nepali, Lingala, Somali, and Swahili were for the other 4 communities that also participated in the same survey. So now let's talk a little bit about who were our participant. So over the next few slides, I will go through participants' demographic before talking about emergency preparedness and awareness. So just one point to clarify, on left side of my screen, you will see the overall result that includes all 5 communities that were included in the original study. And on my right, you will see the results just for the Afghan community. And I believe this way we can understand both the unique experiences of Afghan community, but also the overall pattern we see across all 5 communities together. So for the Afghan community, most of the participants were between 18 and 45 years old. When you compare this with the overall sample we had, the Afghan group was slightly younger on an average. More than half were women, and this strong representation of Afghan women is especially praiseworthy. Uh, we did talk about challenges Afghan women face at the beginning of the presentation. Mr. Ali shared with us, and I just wanted to repeat that many Afghan women, they face barriers to public life due to cultural expectation and other factors, and their voices are often underrepresented in research. So having more than half of the participant women were very encouraging for us, and we do believe this is one of the strength of this survey, that we have voices from Afghan women. Uh, Speaking in terms of emergency preparedness, it is also important to note that women often play an important role in family preparedness during emergency and crisis. They are the decision maker in terms of taking care of children, elders, and household safety. So their voices and their active participation in our survey was very encouraging. So in this slide, we want to understand how long the participants have lived in the state and how comfortable they are with the English language. As you can see here, Afghan participants are most recently resettled group in our study, and Dr. Ali did talk about when they started to migrate in the United States. Um, Among Afghan respondents, majority of them have been living in the US for less than 1 year. So again, compared to the overall sample, we see that they are recently resettled compared to other groups who have lived in Ohio for much longer. In terms of English proficiency, Afghan participants reported lower levels than the overall group. About 43% said they could not read, write, or speak in English. So these findings together tell us something really important from the viewpoint of emergency preparedness. So first, Afghan refugees are still very new to the life in the US. They are still learning to navigate a complex system and in a language that they do not even understand clearly, which means that whatever existing resources we have in place, they may not be accessible or they may not even know about these resources as a community. So in this slide, we look at formal education, and what we see here is a notable difference between the Afghan participant when we compare with other participants overall. Among Afghan community, nearly half of them reported no formal education or having less than a high school education. This is significantly lower than the overall group where more participants had completed high school or even college. This limited formal education combined with low English proficiency can make it even harder for these communities to understand and access emergency preparedness information. Next, we asked about disability status because we believe disability is another important factor when we examine emergency preparedness because individual and household with members with disability, they may encounter additional challenges during the time of emergencies. Among Afghan participants, only 4% reported disability and only 2% were caring for somebody with disability. These findings are lower, much lower when you compare with the overall group. So now let's move to the experience, disaster and emergency experience these communities had. The first thing we asked them was if they had ever experienced a disaster while living in the US. Across all the 5 communities included, we had 20% of the participants who said they had experienced disaster while living in the US. However, when we limit to Afghan participants, that number was much lower, where only 4% of the Afghan community or Afghan participant said that they had experienced a disaster. The difference could be due to the fact that Afghan participants are more recently resettled, so they haven't lived much longer like other groups, and they may not have encountered emergencies while here in the US. Among those who had experienced a disaster, the most common type they mentioned were earthquake, extreme heat, hurricane, power outage, and thunderstorm. Next, we asked participants about what they know about disaster preparedness and what steps they have taken, if any. Among Afghan participants, more than a quarter said that they were not familiar at all with how to prepare for a disaster. Only 4% said they were very familiar how to prepare for a disaster. So when we compare this with the overall group, the Afghan participant had lower awareness level. This shows a clear need for more education and increasing awareness with these communities. Among those who did report some knowledge on how to prepare for emergencies and disaster, the most common thing people said that they knew were making their homes safer, safeguarding important documents, gathering or updating emergency supplies, learning evacuation routes, and getting insurance or their property and belongings insured. Next, we asked participants 2 important questions related to risks and their confidence if it was to happen. So first, we asked how likely they believe that a disaster will affect their area. And if it did, how confident they were to respond to one. Among Afghan participants, nearly 65% said either they thought a disaster was unlikely or they were not sure about it. Only 35% believed a disaster was likely to happen in their area. When it comes to confidence, if a disaster was to happen, the number was even more telling. Only 12% of Afghan participants felt extremely confident in their ability to respond to a disaster. The majority reported low to moderate level of confidence, with nearly half feeling they were not confident at all. When you compare these findings with the overall group, we can see that Afghan participants were less confident in their preparedness. This is a key gap that we all can work together, and maybe we can help build their confidence through training, sharing information, and providing community support for emergency preparedness. Next, we asked participants whether they currently have a disaster or emergency response plan. And among Afghan participants, about 61% said that they do not have a plan, which was very similar to our overall sample. So this shows that most people in our study across all communities, all 5 communities included, they do not yet have a clear action plan in place in terms of what to do if there was a disaster or emergency. For those who had taken steps to prepare for one, the most common action people had done was gathering or updating supplies for emergencies, learning evacuation routes, making their home safer, safeguarding important documents. While all these great first steps are really appreciated, but with so many people and so many households still without a plan, it's very clear that we need to support Afghan families and also other families or other communities that we included in our survey. And with appropriate tool and resources that are easy to understand, culturally appropriate and simple to act on, we could really help them to have a plan in place if there was a disaster or emergencies to happen in the near future. So now let's talk about some of the barriers and challenges participants faced when trying to access emergency preparedness resources. Among Afghan participants, about 70% said that they had not faced any difficulty accessing resources. And 18% of them said that they had never accessed any emergency preparedness resources at all. Only 12% reported facing difficulties while accessing these resources. So this was a great finding that while most of them did not report significant barriers, the fact that nearly 1 in 5 have never accessed any resources shows that limited exposure or awareness that uh, there are resources available. Uh, so next we asked if people knew how to get help during an emergency. And more than half of Afghan participants said that they did not know how to get help. This number was slightly higher than the overall sample, which suggests that Afghan participants may be less connected to the formal emergency management system. Moving next, we asked participants about specific reason that they may have had difficulty accessing emergency preparedness services, and they identified different barriers. Specifically among Afghan participants, about 42% said language barrier was a challenge. And this was also reflected in Mr. Ali's presentation. And this was one of the most significant barrier that our participant experienced, not just with the Afghan community, but with the overall sample as well. Other barriers also were mentioned, and that included cultural norms, gender, race, and religious practices. Next, we asked participants whether they felt the emergency preparedness materials and services were culturally appropriate. For the Afghan community, most of them said that the materials were either very appropriate or somehow appropriate. But a significant number, about 1/5 to be precise, said that the material did not feel culturally appropriate. And compared to other communities, Afghan participants were less likely to feel that the materials were inappropriate. Next, we talked about whether our participant had participated in any emergency preparedness training in recent years. And for most of the Afghan participant, the answer was no. It wasn't due to a lack of interest, but the main reason was that many simply did not know that these training even existed. For others, language was a barrier, and because it was not offered in languages that they could understand. So to make existing resources more accessible, we need to focus on better marketing and promoting these trainings, and if possible in native languages, and hosting them in local spaces, ensuring that they are culturally appropriate and welcoming. So clearly, there needs to be effort to make these training resources more accessible, and we need to do a better job with marketing so that these communities are aware of what resources are in existence. Uh, so now we move to asking them about how to better serve their communities. So we looked at how often emergency preparedness is actually discussed in their community and what approaches work best when it is discussed. Among Afghan participants, less than a quarter said their community ever talks about preparedness. So this was clearly not a common topic within the community. Speaking of the most effective ways to share information are through community meetings, religious or worship gatherings, social media, and partnership with trusted community organization like IIS. So again, this tells us something. Work with the existing community structure. Use the gathering that people already attend. Use messenger that they trust, like local leaders. And that's how we can start shifting awareness and action in a way that feels comfortable and familiar to the community that we serve. When we asked Afghan participants how emergency preparedness could be improved, their suggestions were both practical and very thoughtful. The most preferred ways to receive information were text messages and phone calls, followed by emails. Participants also found other tools like lesson plan, website, digital resources, games, activity books to be a helpful way to learn about emergency preparedness. To improve preparedness overall, they emphasized a few key strategies: creating materials by the community and for the community in languages they understand, offering training in multiple languages. So within a community, people speak and understand different languages. So making sure that trainings are offered in multiple languages so it's easy for them to understand. Hiring multilingual staff uh, who are from and trusted by the community. So some of these ideas really help us to understand and make one point clear, that the emergency preparedness effort that we plan and organize are more likely to be effective with these communities if they are rooted in a local environment with trust and built with cultural respect, and it deliver in the languages and spaces people are comfortable with. Uh, so this was the last slide for my quantitative part. So this is where I wrap up the quantitative survey. And as you can see, people have suggested really wonderful ideas how we can better serve these communities and help them to be prepared at the time of emergencies.
Okay, without any delay, I want to start. So good afternoon. I'm Isha Karmacharya. I'm a doctorate graduate from Miami University of Ohio. I was also involved in the 2024 study, and I had an excellent opportunity to work for ETSS for this project, majorly contributing the qualitative part. So now we'll shift to what we learned from Afghan youths through a focus group discussion. So this discussion was very insightful and important to know their perspectives on emergency crisis and preparedness. We spoke with 10 youths between the ages of 18 and 25 with representation from not only from Afghan community, but total 5 refugee communities in our study. For the Afghan group, we actually had both male and female voices. These youths were recruited through the ETSS Youth Advisory Panel and were all fluent in English. The session lasted about an hour and was guided by trained facilitators. We focused on 4 areas: public health concerns, awareness of emergency resources, barriers to preparedness, and youth recommendations for community action. So I'll be covering more of the voices from the Afghan youths. Several important themes emerged from the focus group discussion. First theme was on public health emergencies and crisis concerns reported by youths. And second, awareness of resources for emergency preparedness. Third theme was about significant barriers and challenges. And fourth was about youth sharing powerful recommendations for action to improve community preparedness. So the first theme, youth participant highlighted several critical public health challenges within their communities. These included substance abuse, suicide, gun violence, social isolation. Particularly in Afghan community, the youths were highlighting the isolation experiencing by non-English speaking women and elders in the Afghan community. Like one youth described how isolation deeply affected Afghan women, saying a lot of women, they don't know how to speak English, how to go outside. They are still at home. Like they are saying, I don't want to go outside. I'm scared from everything. So this shows how social isolation intersect with fear, language barriers, and limited mobility, making it harder for women and older adults to engage in preparedness activities and seek help during emergencies. And youth also shared that these issues are often unspoken or normalized and not treated as urgent concerns, which delays prevention and healing. You also mentioned about what emergencies happen. Like first, they talked about their go-to resources, like for example, phones, Google, social media platforms were their first go-to resources. They also emphasized that faith-based institutions like mosques are trusted community hubs and serve as informal gathering places and coordination point during crisis. For example, one participant shared if anything were to happen, like a big crisis, let's say a tornado or a shooting, everyone would convene at the mosque to figure out the course of action. Youth also acknowledged that some emergency resources exist, but these services are often poorly publicized and difficult to access for, especially for elders and non-English speakers. Like one participant put it clearly, there are definitely resources out there somewhere, but the issue is that finding out about them is so difficult because there is no marketing for them. Participants also mentioned that emergency preparedness is rarely promoted by community leaders. So this shows a disconnect between service availability and accessibility. Youth also identified some of the challenges like language barriers as one of the biggest obstacles to preparedness. They shared that during COVID-19, many older adults in the Afghan community could not understand health messaging and even now don't know how to call 911 service or follow any safety alerts. Like one youth explained, the older generation probably can't even call 911 properly because they don't speak in English. Um, so therefore, participants emphasize the urgent need for translated emergency materials and multilingual response system to help bridge this divide. Youth also reflected on how social media and outside influences have changed their communities. Like, I think we all agree with this. They shared concerns that the community is becoming more individualistic and disconnected, especially among youth exposed to harmful online contents. For example, participant explained, I feel like a lot of it has to do with social media. People see everything online and try to be like that, losing their true selves. I have seen friends change, becoming more violent, influenced by what they see, even though they were not like that when they were younger. Another youth also mentioned about the shift from collective community support to individualism. For example, they said, we went from being a community that always helps each other to grow and persevere to becoming a lot more selfish. So, therefore, while external sources like social media were reported as a source of awareness, they were also seen as contributors to disconnection and risk, leading to people in their community to adopt values that conflict with their community norms. Another important theme was the normalization of trauma, especially from violence and displacement as a barrier of emergency preparedness. Like youth shared that their communities often react to crisis with silence or short term responses rather than long term prevention or healing. Um, like one youth said, people don't question why it might have happened, and they are so used to going through trauma because of the background they come from, they don't even think of it as trauma. So another youth reflected on how gun violence is acknowledged but not discussed in a way that promotes change, saying gun violence still happens this day. I feel when someone passes away, the community kind of comes together, but we don't talk about how we should stop this. We don't talk about how we could move forward from this. So youth noted that people often don't even recognize these experiences as trauma or even emergencies because hardship has been so constant and they are so used to going through all these crises. So this mindset prevents communities from seeking help or planning to reduce future risk. Um, Another important theme was emphasizing the stigma surrounding mental health. So they explained that mental health is often seen as a taboo subject, especially among older adults. So there is a strong fear of judgment. Like one participant mentioned, mental health is not seen as a good thing. It's really stigmatized. If you have a problem, you just bottle it up until you explode one day. So this shows how stigma can keep people from accessing the very care that could help them. Now, talking about youth's visions to emergency preparedness planning, they expressed a strong desire to be seen as active contributors, not just recipient of support. They even mentioned themselves as gatekeepers, like they kept explaining that they can be a medium to reach older adults in their homes and community. So they recommended involving young people in emergency planning and leadership roles, especially through school or community-based organizations. Participants also suggested youth should be seen as community assets and part of solution. They emphasized starting with some informal relationship building events. For example, one youth pointed out they are more comfortable spending time together first, like for fun, and then going out together to volunteer or assist others in the community, saying that they hinted about experiencing comfort, connection, and trust within the community prior to getting involved in emergency preparedness planning and leadership roles. Youth also emphasized the importance of clear, culturally relevant communications. They suggested using trusted messengers to deliver emergency information, such as community elders and spiritual leaders or creating promotional videos with familiar faces, someone from their community whom they can know or relate to. They suggested sharing emergency preparedness information via YouTube, Telegram, WhatsApp, community centers, and mosque. Participant also suggested adding multilingual translators to 911 services to help bridge urgent language gaps. For example, participants mentioned if 911 got some translators in a different language, that would help a lot. Finally, youth stressed the need to build on existing culture and faith-based networks like mosques and other religious sites already serve as trusted spaces and should be recognized as key partners during crisis. Rather than replacing these traditional systems, youth recommended that public health and emergency organizations should work with them. Participants mentioned that the biggest type of intervention we usually have stem from religion. Also, participants emphasize community programs and helping each other to become aware and learn from each other. Like one said, if organizations like yours, that is indicating ETSS, or others offer similar programs for people like me, it can help us improve ourselves. I have learned a lot from them, that is study participants, and I think it's a great idea. So therefore, the takeaway here is clear. Social support and culturally grounded engagement is essential for emergency preparedness. So this is all I have from the qualitative findings. So now I'll pass it to Jet to continue the presentation.
That was very insightful. So for this project, we had to make social media posts. Each one of our team, so we have community health navigators. We had one that represented each of the communities. For the Afghan community, we had Shafula, and this were some posts that he created for his community. So the way that our community navigators did it was they went out to their communities, they asked them, hey, what is current emergencies that you either experienced recently, or they looked back at their most recent cases and saw what was the most recent emergency that their community experienced. And that's why they decided to make the post they did. So Shafula made a post on conservation tips. So if people are facing droughts, he made a post on severe storms. And then he also made a post on floods. All of these posts were translated into Pashto and Dari and all of the other languages by Shafula for Pashto and Dari. He was the one that provided those translations. And then, so these are the 3 posts that he made, and he also made some videos. We will play one video. So let's do you know about traumatic events and disasters? Let's play that one.
Did you know about traumatic events and disasters? Here are some tips. Prioritize your well-being. Connect with friends and family. Reduce your news intake. Ensure you get quality sleep. Set and follow a routine.
So thank you so much for playing that. So that was just one of the 2 videos that he created for this grant. And then you can see that the translated versions are right underneath. And then he will be able to tell you if it was Pashto or not. And if you have any specific questions for him on these posts, feel free to share it to the original email, the prepare to MHA, that email, and then we'll get back to you shortly. So let's go to the next slide. So now I'll be talking about just some social media outreach. So as you can see, these were all the platforms that our social media was posted on. So let me just pull up the correct script. So dissemination included Instagram, Facebook, Twitter, LinkedIn, WhatsApp, and as well as text messages, phone calls, and in-person outreach. In the next slide, you will see an apricot data. You will see contacts versus materials distributed, and that's where I'll get into more of the phone calls and in-person outreach. So I already gave a shout out to Shafula. So thank you so much, Shafula, for going out to your community and getting the information to them. So for the Afghan community, when we look at the information dissemination, Shafula had 5 total contacts and he distributed 3,452 materials. And that was in multiple languages, not just in English. He was also in Pashto and Dari. And the difference between contacts and materials distributed is materials distributed just means that you sent the information to the client. There was no follow-up. Whereas a contact means you followed up with the client and it was an interaction that was less than 15 minutes. If it's 15 minutes and over, if it's 15 minutes and above, then it's a whole different form called the individual family encounter form. But for this project, we just use the apricot weekly tally form. So next slide. So this right here is for the emergency kits. So for this project, we built 250 emergency kits. We distributed 50 kits to each community-based organization. So we gave Mr. Ali and the Immigrants Integration Station 50 emergency kits to distribute to his community. There was not exact guidance on distribution, but we said, you know, if somebody in your community has like a power outage or just any other disaster or crisis, to please go ahead and distribute it to them. As you can see, these were the supplies in the kit. We had a flashlight, we had a CO, carbon monoxide slash smoke detector. We had an emergency radio. We had a fire blanket. We also had a emergency blankets. I didn't know there was a difference, but we had both of them, a fire blanket and an emergency blanket. We also had some 988 resources that we translated for Adam H in their specific language. So for the Afghan community, we put in Pashto and Dari in English for that. We had some body wipes and some hygiene kits. And then we had just some extra stuff, some very useful things, a COVID-19 test, instant code pack. And we partnered with JPS Printing to make these kits. And thank you so much for doing that because it turned out much better than we expected. So thank you so much for the community partners for distributing these kits, and thank you, JPS Printing, for creating them. So now we will go over the collaborative platform. So in times of crisis, if you can go to the next slide. So in times of crisis, we know how important it is to have trusted, organized connections in place. That's why we created a collaborative platform for crisis response and referrals, where we gathered contact information from 81 community leaders across 5 refugee communities. Those communities were the Afghan, Bhutanese, Congolese, Ethiopian, Eritrean, and Somali. For the Afghan community, we have 15 contacts, including Mr. Ali. If you want to reach out to any of these 15 contacts, let's say you have an emergency within the Afghan community and you're trying to get a hold of somebody to contact to see, hey, how do I bring your community in to assist with this? Please reach out to me. My contact is right there, jetjama at ethiots.org, or you can call me and I will go ahead and get you in contact with the correct community leader, which will in turn get you in contact with the community representative. We have 15 community representatives for the Afghan community. So now I'll go over just some policy implications and strategies recommendation. So for the Afghan community, one, develop culturally tailored educational materials in both Dari, Pashto, and Urdu. That is another language that the Afghan community speaks. So if you're able to translate it into all three languages, I would, but I would also just, if you can't do all three languages, I think Dari and Pashto are fine, and most of the community members can understand those two. Provide language interpretation services during preparedness training sessions, increase community engagement through partnership with mosques and Afghan community leaders such as Mr. Ali to build trust and deliver culturally appropriate messaging. So sometimes when you translate things word for word, it can get lost in translation. So partnering with just somebody from the community to make sure that what you want to say is actually what's said in the translation. So offer disaster drills and interactive workshops to increase confidence and preparedness skills. So these workshops, I would just also suggest hosting it and maybe even in mosques, bringing it to the communities so that the community doesn't have to come to you. And then just use visual aids for low literacy friendly formats to ensure information is accessible to all community members. Earlier, you heard that there's different levels of um, English proficiency and even within their own language. So some people can speak in their language, but cannot read or write in their language. So visual aids are very, very helpful. So now if we can go to the next slide, I think there's just a few more. So design trainings with gender sensitivity and strong confidentiality safeguards to promote comfort and trust, especially for Afghan women. So earlier you heard from the leader, he said he has Afghan women that teach Afghan women driving skills. That's what you need to do because if a man is there, some Afghan woman might not feel comfortable to even open up to the man. So just make sure you're very sensitive when it comes to gender, and then involve Afghan youth in planning, peer education, and social media outreach. They're very excited to get involved. We were excited to hear from them, and I'm sure if you reach out to them, they would want to get more involved. And then support youth-led initiatives through student organizations and community-based groups. And then schedule trainings outside of work hours and offer transportation. Something that we do is we even incentivize the community to come to certain things. So a gift card or quota bus passes, just so that the community can feel motivated to come. And then recognizing that many Afghan households rely on a single male earner. So just keeping that in mind and making sure, hey, you're making this time, so let's go ahead and incentivize you. So now I will just quickly go over some just resources of what's available at ETSS. So at ETSS, we have the Adult Services Program, Youth Services, we have Resettlement, and we have the Grassroots Empowerment. And then if you want to more information, please visit our website. We have more information on there. And then here are the translated Adam H materials that were in the emergency kits. There's links. We will go ahead and share these slides out later, but we translated them, our team. We partnered with Adam H and we did reverse translation where they provided the translation and we just looked it over and corrected a few things. And we have them available in multiple languages. I'm willing to take a few questions, maybe 5 minutes, and then if we need to bring Mr. Ali, we can as well, if you have any specific questions for the community. Okay, so I will let Mr. Ali answer that question. I think earlier he mentioned 97,000 or something, but I'll let him answer it. He will be able to answer it. Thank you.
Yes, what was the question? Sorry.
So what is the population of Afghan people in Columbus or Ohio? In Central Ohio, and then the kids, what was the kids? Where did you distribute the kids? Like, did you take them to people's houses or did people come to organization and stuff? So for the kids.
most of them, because we are running the ESL and driving classes, so most of them we distributed over there. The remaining we distributed to the house to house and just went to the house and just distributed that. And in our Columbus, we have like more than 400 to 800 families are living here. But Afghan community, like, every month we are like having more kids. Every month like last month we had like 7 or 8 kids born in Columbus. So and next year and couple 5 years there will be a double or triple community we will have. We like to having a big families. This is one of our, I know it's, just rising them up very hard, but it's something that in our community, the smallest is probably will be 5 kids. Like just a few families, they will have a 3 kids or 2 kids, but the most of them, the average is like this 5. We have a families who has a 12 kids and 10 kids as well now. In Ohio, especially, we have Franklin County, because the most of Afghan, they are so bounding people. If they see that there is a Afghan families that are living more and more here, so they will try to be select that family. They cannot leave like far from the families, because we during the any of the issue happen or any disaster, so they would like to be connected, and so they are very bounding. In Cleveland, we have a big community as well, and in Akron we have, and Cincinnati we have a community over there. But we have Toledo, but there's just few, and most of them are like first is now Columbus is the first, second is Cleveland, and Cincinnati and Akron comes like in fourth and five. Any other questions?
In person or virtual?
Any? No? Okay. Thank you guys. Appreciate it.
Thank you so much for that, Mr. Ali. That was very informative. But thank you so much for being here with us today, and enjoy the rest of your day, everybody.